Welcome back. Milwaukee County is in the high transmission category for COVID-19 as we head into the Memorial Day weekend. And we're joined live this afternoon by Dr. Jeff Pothof of UW Health. Thanks for being here on Tuesday, as you normally are. We appreciate it. And Dr. Milwaukee County just issued a mask advisory, not really a mandate, but they would like you to wear one. The zoo is asking people to be masked when they're indoors. Do you think the numbers warrant this, or are they going to spread here?
Yeah, when the community gets in this CDC high level, what that means is it's a combination of an increase in cases, which I think we're all seeing, as well as some marker of hospital resources. How staffed is your hospital? Do they have beds available to take care of people who come down with COVID or other things? When you get in that high level, that means both those are a bit strained. So what that means is that if we can, for at least a short period of time, a week or two, put on those masks when we go into crowded indoor spaces, we reduce transmission and we drop those cases, but we also ensure that the hospitals in the community are able to take care of all the patients that are seeking out their services. So while we're in that high transmission group, outdoors is pretty safe. I won't worry about it. But if you're indoors in crowded places, there's a lot of COVID going around. Putting that mask on for a little while might not be a bad idea.
You mentioned outdoors. A lot of people will be outdoors in the coming weekend, but are there concern with the surge in cases after this long holiday weekend?
Yeah, I think we could see more cases. Now, things are very different right now than they were in previous surges. What we saw in previous surges is after the cases increased, we always saw an increase in hospitalizations, and then we would always see an increase in deaths. And this time around, through two things, both people being vaccinated and boosted, but also those who aren't recently likely having COVID back in, February, March. We have some underlying immunity in the community that is causing us to not see as rapid rise in hospitalizations and not really seeing the same number of deaths as we were in previous surges. So a different scenario, but nonetheless worth paying attention to this weekend, so you don't find yourself sick for the next 7 to 10 days after your Memorial Day holiday.
Let's talk a little bit about vaccines. Last week, the news was that kids 5 to 11 could get the booster. Now, Pfizer just submitted data to the FDA for a 3-dose series for kids under 5. Moderna did the same thing a little before that. So what should parents of young kids know right now, and why so many doses for these kids?
Yeah, so a lot of good questions there. I think one thing for parents to know is that likely by July, we'll have some pretty good guidance and probably availability of vaccines for those 6-month to 5-year-olds. The reason for the different dosing schemes is Pfizer initially tried to do a 2-dose series with a very small dose compared to what they were giving adults and older children. It didn't generate the immune response that they were hoping to see. A 3-dose series did generate the immune response that really kind of mimics what we're seeing adults and older children get. Moderna did a 2-dose series with a higher dose. They got lower performance than the Pfizer 3-dose series, but likely Moderna will be a 2-dose followed by a booster later, likely will perform similar to the Pfizer 3-dose. So all in all, kind of the same, whether it's Moderna or Pfizer. I think parents will be able to get their 6-month to 5-year-old kids vaccinated sometime July, August.
All right, Dr. Jeff Pothof with UW Health. Thanks for being with us here on this Tuesday afternoon. We appreciate it. And a reminder that you can always find the latest information on the pandemic, including county-by-county numbers and information about how to get vaccinated at tmj4.com/coronavirus.